If we can spend time to ensure that they have their CPR certification, we can ensure that our nursing staff have time to understand and learn genomics.
There is that little tick of anxiety that goes up because you're right. You immediately think of, or I immediately think of, bench scientists who are working on taking apart the DNA and pulling out the little markers. And how in the world do they do that? And then how am I ever going to understand that?
I think I just want to encourage our nurses to give genomics a chance. You never know how much you're capable of learning until you give it a try.
You're listening to the Oncology Nursing Podcast, where ONS Voices Talk Cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from bench to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast.
Hello, and welcome to the Oncology Nursing Podcast. I'm your host, Stephanie Jardine, Oncology Clinical Specialist at ONS, and today we are joined by ONS member Karenza Marty, Manager of Training and Education at Sarah Cannon, the Cancer Institute of HCA Healthcare in Nashville, Tennessee, and board member of the Middle Tennessee ONS chapter, to discuss the importance of integrating genomics in oncology nursing education from undergrad classes to staff training and beyond. AstraZeneca sponsored this podcast episode, which is brought to you by ONS. Thanks for joining me today, Karenza.
Good morning, Stephanie. How are you?
Doing well. So I'm looking forward to our discussion today. And to start us off, can you walk us through the history of genomics in formal education for nurses?
Yeah, absolutely. I'd be happy to. I think one of the things that we want to be aware of is that genomics education hasn't really been represented well in the undergraduate program. Despite our efforts to determine what content needs to be delivered in undergraduate programs and lots of standards that have been established through various nursing professional organizations, we've yet to really see a transition into the development of a genomic curriculum for nursing programs. So while we have seen some elective courses and we've seen some genomic content incorporated into pharmacology courses, we've not really seen schools of nursing adopt a genomics program and really integrate that content into their curriculums.
So then how has education evolved to include genomics now?
I feel like we're still seeing nurses miss the mark in terms of understanding genomics in the undergraduate programs. In my experience, most of the nurses learn about genomics through on-the-job training, through discussions with physicians, with their nursing peers who have been in nursing for numerous years and have come to learn that content on their own. I've also seen nursing education programs pushed out through pharmaceutical sponsors. And that's been a lovely thing to see because we help correlate the why behind genomics. It really helps the nurse to understand why he or she might be administering a type of therapy based upon the genomic profile of that patient. We've also seen education programs that are sponsored by the institution for which the nurse works. For example, the institution that I work for, that is something that we are developing. We, are thankful to have programs and departments in place to support that content and that knowledge for nursing staff. So we're seeing it in a variety of different places, but it seems to be on the back end once nurses have completed their undergraduate programs and completed licensure even.
I work with the conferences that ONS provides. So our ONS Congress, our Bridge Conference, and things like that. And I have to agree with you that what we have seen is there are a lot of nurses who indicate that that is an area of need for education. And every time we have a course or a session that is related to genomics, it is very, very well received. And we can also see just in research that is coming out, there's a lot of reports coming out that the history of genomics in undergraduate curriculum is really, really limited. We hear that from our faculty members that have oncology in their background, as well as, like you're saying, just from educators that are in these institutions and see the new nurses coming in, and with all of oncology really having much more focus in genomics and understanding that there's a gap and a need.
Yes, and you are completely spot on, right? We've seen a shift in how we're treating our patients in the oncology realm within the last 5-10 years. So from the development of many targeted therapies to our immunotherapy drugs, we really need to have a better understanding of genomics and how that can influence our patients' care. But again, our undergraduate programs, we're just not seeing this content covered well. And so when we have nurses who begin a career in oncology nursing, they're really at a disadvantage in compared to nurses who have been in the oncology realm for 5 or 10 years, because those nurses who are new graduates just don't understand the foundational genomic component to patient care. And for them, it can be very frustrating. For them, they can feel very overwhelmed and very unconfident in their ability to provide care because this genomic knowledge is not there. So for today's nursing students, we really want to see schools of nursing incorporate genomic curriculum into their programs. So then that way, when they do come to various organizations and begin their career, they have that knowledge, they have that foundation, they feel confident to really care for patients in this very unique realm.
I agree with you. And I think what you said about getting nursing schools to start to incorporate that is so important. But even more important than that is just the foundation of that knowledge, because as we're seeing, there are new targets and new markers that are being discovered and changing oncology care so quickly that I can't expect that there would be any way for, schools to be able to keep up with all of that. But if they could give that foundational knowledge so that they understand what and how genomics works in whether it's oncology or just the patient's health outcomes overall, would at least shorten the gap that we have when they're coming in to practice. So in thinking about it that way, how do you, as a training and education person, overcome that knowledge gap with new nurses coming in from right out of school?
There's 2 things that we can really do, right? I feel like the first would be to start to establish a collaboration between oncology practices that are in the community and the schools of nursing that are in the community, and provide expertise, because nursing faculty, unfortunately, don't have the same level of expertise in genomics that perhaps our practicing nurses have. So how can we leverage them? How can we connect these 2 groups to provide our nursing students with a better understanding, and then also make sure that faculty learn as well, right? When I think about my nursing school experience, the faculty had been in nursing education for quite some time and really leaned into the aspect of nursing education and not so much the changing landscape, particularly within oncology, right? That's almost a niche area, if you will, at times. We consider it that way at times. So faculty probably don't have a great awareness of genomics. So how can we leverage those individuals within our oncology practices? So I think that's really one way. Another thing that I think is really great is the use of ONS and continuing to connect our nurses who are leaving the undergraduate programs, getting their licensure, coming into the world of oncology. And I think becoming a member of ONS very early on in your career is super beneficial. There are so many resources that the Oncology Nursing Society has and so many great connections that I think we really need to leverage the content that ONS has provided. And I would really love to see oncology practices lean into the content that's out there a little bit more. I certainly know within our programs at Sarah Cannon, we heavily rely on the oncology and immunotherapy courses in order for chemotherapy, biotherapy, immunotherapy certification. So I think those kinds of courses are lovely. And I would love to see us start to lean into the ONS programs more in terms of genomics.
Those are some really good points. I agree with you that faculty already has a big job on their shoulders to get these nursing students to the point of graduation and taking their NCLEX to, become registered nurses. And just the breadth of information and knowledge and education that has to be done in schools of nursing is huge. But I will say, kind of as you have alluded to, oncology curriculum is just not one of the areas that is focused on. I mean, we really don't have a lot, and we're hearing there's not a lot of oncology curriculum in schools of nursing. And I know it's going back a long time, but when I was in school, the only oncology option that I had was, like you're saying, an elective or kind of that senior seminar type of course or elective that you could take, and you got to pick your location. So I was able to pick an oncology area, but if schools of nursing don't have access to places like Sarah Cannon and some of these other great oncology practices and institutions, then those students don't have access to that. But one thing that is happening, and I feel like the general public is becoming more aware of and not understanding, because like you said, it's hard enough for us to understand genomics, but they're hearing it, and they're hearing it because of the Human Genome Project. And just with things like that, that has kind of pushed genomics into the forefront, not only of healthcare and nursing education or understanding, but also in the public eye. So have you seen that things like the Human Genome Project have really kind of expedited the need for education in genomics in oncology nurses?
So, Stephanie, I could not agree with any more of your statements more so than I definitely think the Human Genome Project really, really put a light on the fact that nurses need to understand genomics. You're completely correct, right? We have seen patients become much more of an advocate for themselves or for their family members in terms of trying to understand what biomarker testing means in terms of impacting treatment, impacting response to various therapies, and even trying to understand what that means for their family members. So, for instance, BRCA testing, where does that leave a patient's family member? How do we help them feel comfortable and confident having conversations? We're lucky that we have genomic professionals and genetic counselors out in the community, but nurses need to also feel confident and to answer some of those basic questions for patients. The other thing that we're seeing are those DNA profiles like the 23andMe, and those bring a lot of questions. Patients will ask nurses, what does that mean? Is that something that I should do? Is that something that my family should do? Is it going to give me more information about my health? Should I eat this? Should I not eat this? There are definitely a lot of questions out there. And the Human Genome Project, in terms of understanding what gene sequences are there and how those gene sequences relate to protein synthesis, These all have implications throughout nursing, even on drug metabolism. So from the pharmacology aspect, it's important for nurses to understand genomics. So I could not agree more that the Human Genome Project certainly expedited the need for the genomic education within the nursing realm.
I agree with you. And you did bring up another really good point, the 23andMe and the tests that patients or the population is doing on their own, and then bringing those results back and wanting to know, what does this mean? So even in something like that, just recognizing how important it is for us as oncology nurses or nurses in general, just to understand and have that foundational knowledge of what those kinds of things mean and how to talk to our patients, as well as how to encourage our patients to talk to their physicians about that, or the nurse practitioner that is in the practice that's taking care of them, and how to really try to understand that, because I think there is a lot of uncertainty when they get some of those results back. But in looking at all of that, talk about the importance of integrating genomics in nursing education and how it affects clinical practice too. And I'm talking probably more at the institutional level and not necessarily in the undergrad level, but in clinical practice with those direct care nurses that you work with.
Certainly happy to do so. Our research nurses need to understand genomics so that way we can understand why patients were placed on specific clinical trials. We need to understand genomics so that way we can determine whether or not that patient needs additional biomarker testing. There's a lot of different reasons why we need to understand genomics, and it affects clinical practice because the nurse needs to understand what to expect. When we think about how our nurses are educated, we think about, well, the nurse should expect the physician to order, right? Those are very typical questions that we see on our nursing exams. When we think about how nurses influence clinical practice, we think about our nurses as advocates for our patients. Understanding genomics in clinical practice is very important for our nursing staff so that they can feel confident and knowledgeable to advocate for patients. We want for our nurses to know genomics so that when they see a biomarker testing report, they understand what the treatment implications might be. We want them to understand genomics so that they understand why a patient might be placed on a specific therapy or be eligible for a clinical trial. We want nurses to feel confident in genomics so they can help the patient understand what that means for the patient's family members. So we can integrate genomics into nursing education by always leading with the why. I feel like that is so important for adults when we're learning, is to lead with the why. Why is this information important? How can it help my patient at the end of the day? And how can it help me to be a better nurse?
Some really good points. Thank you. What are some evidence-based educational strategies to train oncology nurses in genomics that you're using?
So some of the evidence-based education strategies we are implementing include just-in-time training. This allows the nurse to access various resources at the time that he or she is providing care for that patient. Some other evidence-based strategies include simulation. We know that simulation is very effective in allowing nurses to have some practice, but yet not always have to have that real patient anxiety that comes when facing a patient. And so utilizing simulation, I think, is a great way. So using various case studies to help nurses understand testing reports, why the patient was placed on a various therapy, understanding what variants of unknown significance mean, understanding what pathogenic variants mean, all of those can be built into a case studies. So we're seeing simulation, case studies, and just-in-time training utilized as education strategies to get nurses prepared for genomics.
Those are some great ideas. With how busy clinicians are right now, and with how fast things are changing. Not only are you having to work and learn all of the new treatments and therapies that are out there. Now we're talking about adding on the biomarkers and understanding the genetic testing that is going on. And on top of that, just the past year and a half and how staff are reporting feeling overwhelmed and burnout and things like that. So you're taking all of these things into account. So now I'm going to ask you, what advice do you have for the nurse leaders to engage their busy staff? We're asking everybody to understand this and know this, but what kinds of things could you tell another nurse leader to help bring this education in the midst of all of that?
Right. And I think it's tough. We're in how many times have we said we're in a new world, and, COVID is taking its impact on everybody. And so it's challenging times. We're seeing nurses leave various inpatient positions and move to outpatient positions where perhaps they have a little bit more flexibility, or perhaps even a decreased exposure to COVID positive patients. So for nurse leaders to engage their busy staff in genomics education, I think that there has to be a culture shift, and there has to be value placed on education, just as we have value placed upon our patient satisfaction scores, just as we have placed on our physician satisfaction scores. We need to think about our nursing satisfaction scores, and we need to think about how do we intentionally carve out time from a nurse's busy day to take time and develop their knowledge, develop their skill, develop their confidence. So my advice to nurse leaders would be to find ways to carve out specific time for nurses to develop. If we can spend time to ensure that they have their CPR certification, we can ensure that our nursing staff have time to understand and learn genomics.
Thanks. That is a really great piece of advice for oncology nurse leaders who are out there and thinking about adding on just one more thing to not only their plate, but their educator's plate and their direct care nurse's plate and things. And I think it is really important to just be able to talk to them about the importance of this knowledge and information and how it will help their nurses feel more confident in the care that they're giving. Now I'm going to ask you about some training things. What additional training do oncology nurses need to bridge the gap in genomics knowledge?
I think oncology nurses need additional training in really understanding genomics, understanding various genes, understanding how those genes react in specific environments. I think they also need to understand a little bit more about protein synthesis. I think we need to understand more about biological pathways and how genes influence those biological pathways. I also feel in terms of genomics that patients would benefit from a nurse who understands the difference between germline and somatic variants, understanding how that information is utilized in treatment practices. So I think that there are lots of different ways that we can train our nurses that are on the floor or at the chair side, if you will, taking care of our patients. And like I said, we start with the why. We help them understand how the genomics of that particular patient can influence their therapies that are selected. Also, helping them to understand the testing and being able to speak to that testing is super important for our oncology nurses.
You've brought up so many good points and so many things that are important for our nurses to know, and how quickly the landscape is changing and why we need to make this kind of a priority. You have given us a lot of information today and really talked about the importance of education for nurses, whether it's in their undergrad programs or once they get their job and they're in that oncology world, and recognizing where the gaps are in their knowledge for genomics and, being able to care for their patients in a confident way. So I appreciate everything that we've talked about today, and we're getting close to the end of our time. So I like to finish out our podcast with 3 questions every discussion that we have. And I just want to start those questions off with you as we wrap up here. And the first one I want to ask you is, what are some resources for nurses who want to learn more about genomics?
Yeah, we're lucky in that there are a lot of great resources out there. So there is the International Society of Nurse Geneticists, ISON. So that's out there. There are lots of great resources there. Of course, ONS has a great genomic library that most everybody should have access to. What's lovely is that you don't have to be a member of ONS to have access to that material. Also, cancer.gov, cancer.org, those are great resources. And the NIH has a great resource on understanding genetics, even kind of walks you through the Human Genome Project, what that looked like historically. So there are a lot of great resources that are out there, but those tend to be my favorites.
Perfect. What are common misconceptions about genomics in nursing education and cancer care?
I think a lot of the times it feels overwhelming and daunting. You say the word genomics and it almost gives people a sense of anxiety as soon as you say it, because it's not that it's taboo by any means, but it feels complex, right? We think about geneticists and people who work in the field of genetics as perhaps being brilliant and amazing minds, and they are, but it doesn't mean that our nurses who are taking care of our patients aren't brilliant and have amazing minds. They do. And sometimes I've seen nurses lack confidence in their own knowledge. Sometimes you just wish you could give them a dose of your own confidence, right? Just to say, I know this, I have this, I own this is my nursing practice, I can do really well. And it's not as challenging as we give it credit for. We have the potential to understand genetics. We have the potential to understand genomics. So giving ourselves the chance to say, yes, I can learn this information. It does play a role in caring for my patients, and I want to care for my patients in the best way that I can. And knowing too that this landscape is not going to go away. We are only going to continue to get more and more complex in the world of genomics. So how do we start learning right now, today, to care for our patients in a better way?
I don't think you could have said it better. And I completely agree with you that when somebody says, do you understand genomics? There is that little tick of anxiety that goes up, because you're right. You immediately think of, or I immediately think of, bench scientists who are working on taking apart the DNA and pulling out the little markers, and how in the world do they do that? And then how am I ever going to understand that? So I think that was a great way, but you're right. Once we do have that foundation and we understand it and we can start putting those pieces together, the confidence that we have in being able to talk to our patients and their families about this information is just huge. It's really, really important. And you do kind of take that confidence up about 5 notches or more once you get there. So last question, what's something about genomics education and cancer care that's not often discussed, but you wish people knew more about?
Yeah, I think one of the things that I wish patients knew more about, and it's funny because we just mentioned that this is something that you can understand, but that I wish people understood that the world of genomics and genetics we're still learning. We are still learning what variants are pathogenic. We're still learning what variants are benign. And so when we think about the education piece of it, we need to remember that it is not one and done, that we need to continue learning, and we need to continue not necessarily honing our craft, but sharpening our skills, sharpening our knowledge. Just as the technology changes and the treatment changes, so shouldn't our knowledge. We should be keeping up with what's current practice. We should be keeping up with how that influences our patients. So I think that's something that we don't necessarily talk about, is trying to stay on top of kind of the latest and greatest in research, but it's something that we definitely need to think about on a regular basis.
I just, again, want to thank you for talking with me today and talking to us more about genomics and cancer care. And it has been a real pleasure to do so. And do you have any final comments before we close up today?
I think I just want to encourage our nurses to give genomics a chance. You never know how much you're capable of learning until you give it a try. And there are lots of resources available to you. And there's lots of individuals who are more than happy to take 15, 20 minutes of their time and help you understand. So if you see somebody who feels like an expert in this realm, take a minute and ask them. Ask them to help you understand more and start building those connections and building bridges so that you can increase your own knowledge and confidence to take care of patients who are all so very near and dear to our heart. And we really, really want for them to improve in their conditions, and we want to see them have a better quality of life. And so who better to improve the patient's quality of life than the nurse providing their care? And that's you.
Corinza, thank you so much. I really appreciate you being with me today. And thank you for your passion in nursing education and for just sharing your knowledge with us.
I loved being here with you today. Have a great one.
Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part of this episode by leaving a review on iTunes or wherever you downloaded your podcast. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org. The ideas and opinions shared in this episode represent those of the guests and not necessarily ONS.